Welcome to the Eye on Annapolis Local Business Spotlight. There are thousands of locally owned businesses in the area, some small and some large. Some you may know and others you don't. But one thing they all have in common is a great story, and we want to share it with you. Join us every Saturday as we talk to the founders, the owners, and the managers of local businesses you have come to know and love, and those you will come to know and love. Now here's your host, John Frenay, with this week's Local Business Spotlight.
When you have an opportunity to record a podcast outside drinking hot chocolate and hot tea, you don't pass it up. And we're here today with Dr. Neidig, who is a dermatologist here in Annapolis. How are you?
Doing well. How are you?
Good. Well, I will say that you are a dermatologist, but you're not really here in Annapolis quite yet. You've got a couple more days for a practice to open up, right?
Correct. Yeah. So I am a hometown, born and raised here in the Annapolis area, and I am finally returning to opening my own dermatology practice. And so my roots here, so I can give back to my community and provide top-notch dermatology care.
What's awesome? Well, the practice is Modern Dermatology of Maryland. And you guys are opening up where? Right on Riva Road, sort of, I'll say the Dunkin' Donuts corridor, but it's, right there between 665 and Admiral Cochran Drive, right?
Correct, yeah. So we tell everyone it's right next to Dunkin' Donuts, but it's a remodeled white building called the Offices at Riva. Lots of parking, very accessible, and completely remodeled building with a brand new practice right on the first floor.
Well, how did you get into dermatology? I mean, you're a young guy. Where did dermatology come from? Was that
So I did not go to medical school thinking I would be a dermatologist.
I've spoken with several doctors, and I've spoken with plastic surgeons, and they're all like cardiologists, and they're like, yeah, no, I was going into something totally different. I imagine that's pretty common.
Yeah, I mean, it's you come in with an idea of what you think you like, and then as you really experience and work in the different fields throughout medical school, you get enough exposure to realize what really gets you excited and allows you to feel like you're using all of your skills. 'Cause medicine these days is very specialized, so it's important, like if you want to see children, you have to be in a specialty that allows you to see children, or you have to be in pediatrics. So I really enjoy seeing children. I feel like I make a big impact there. And then just really, opening up all my skills, surgical, scientific, like immunology, medical, getting involved in some of the newer treatments and evidence-based care and just trying to being on the cutting edge. And I think that's kind of why I went with the term modern dermatology, because I want to be treating and giving people a service that is top-notch, 5-star, the best dermatology in town.
Well, I imagine it's changed quite a bit since when, and I'll admit that I haven't seen a dermatologist in gosh knows how long. It was back in high school when when you get the zit and that date coming up, and it's like you go and you get a tetracycline pill, and hopefully that'll take care of it. I mean, I imagine it's all really changed.
Yes.
What are the core services that you guys offer at Modern Dermatology?
So really, I mean, we're trying to check all the boxes and offer medical, surgical, cosmetic right out of the gate. I'm very well trained in all those, and I'm definitely a jack of all trades. I like to do everything in-house because I know patients are going to get really high-quality care. Kind of the newer wave is to kind of get people on the treatments that not only control their condition, but make them feel like they don't have it anymore. Give them as close to a cure as possible, and to be a little bit more kind of personalized and focused on what their goals of treatment are and to get them to their goals. So everyone's goals may be different.
You mentioned medical, surgical, and cosmetic. I mean, what are the types of things? I mean, I imagine medical, skin cancers and melanomas and stuff like that play into that. Obviously, that's more of it's a cancer doctor that does that, but I imagine that probably works hand in hand with a dermatologist. And I mean, you're probably the first one to see that in some cases.
Right, correct. So, I mean, especially in this area, and I previously practiced in Annapolis for a couple of years, and, there's a lot of skin cancer in Annapolis, and there's a huge need for skin cancer screening, skin cancer awareness, sunscreen, and just being on top of those patients, identifying who's at risk and making sure they're in the office, and then also identifying, who's not at risk. And sometimes, people are a little bit more anxious and worried about it than maybe they should be for their life stage. So it's important that, everyone can be a patient, but we don't make a patient out of everyone. Screening those where it's appropriate, where they have a family history, they've never had a screening, and then we kind of see what their risk factors are for skin cancer and making sure that they get the appropriate follow-up treatment, and that they're not undertreated, they're not overtreated, they're appropriately treated.
That makes sense.
And because you can be kind of a hawk, and sometimes, we don't want to do more than what people need. And I think that's very important to me, to make sure that, patients are informed and they make their own treatment decisions as we're, counseled by a board-certified dermatologist.
And I imagine a lot of that has to do with all the water that we have around us in the bay, and people are out
Correct. Yep.
Fishing, sailing, and everything else.
Right. So there's a lot of outdoor activities, Annapolis and the population in general. I mean, in some cases, an aging population, more at risk for skin cancer, more activities outside, and some of this genetic predisposition. I tell a lot of my patients that, the numbers are now, closer to 40% of Caucasian patients will have skin cancer in their lifetime. When people hear those numbers, it's shocking. And I tell a lot of my patients when they get skin cancer, they think that they did something wrong, there's something wrong with them. In reality, a lot of it's really wired in, and the fact that folks are living longer, that's one thing. And then the other thing would be, the ozone and UV exposure. UV has actually gone up since, the 70s, like 50 years ago. It's increased at least 30%. That might to explain some of it, the aging population. And then surveillance has also increased, awareness, dermatologists, the number of dermatologists, the number of treatments and biopsies and things we're actively, aggressively looking for it, where I think, previously, historically, either people weren't living that long, or it was being swept under the rug by a primary care doctor saying, no, it's not that bad, you'll be okay. And they only treated it if it became, very symptomatic.
I think that you're seeing a lot of primary care doctors, as you said, they were sweeping it under the rug, or just sort of, it's nothing, don't worry about it. I think I'm seeing, at least, or hearing the stories of a lot of primary doctors that are now coming saying, well, let me have somebody else look at this that's a little bit better. Let me send somebody to Dr. Neidig and have him take a look and have him say no. He's the one that sees this time and time again, as opposed to risking it and just sort of winging it and saying, yeah, no, this looks good.
Yeah, there's so many subtleties to the skin exam and to skin cancer and to, the treatment or diagnosis of getting just a mole check. So it can be a healthy patient, and then we find out very quickly that there's something going on that that needs to be treated and addressed. We really prefer that the primary doctors do refer to the dermatologist, just because we know what we're dealing with. We see it every day, all day, and if there is an issue, we're going to take care of it, see it through to the end. And then some offices, I think primary care, will actually offer a skin check. And sometimes it gives the patient a false sense of security that they don't have a problem, and where there may be a very subtle or early problem that's a little bit difficult to diagnose that we would rather catch early. So I don't put a lot of stock in a skin check provided by primary care, but it is a good screening tool to say, you know what, I saw a few things that you should really go to the dermatologist. So for those reasons, I do support it, but it should not be in place of a dermatologist exam.
That makes sense. Surgical and cosmetic. I mean, cosmetic, the first thing that comes to my mind is like Botox and scrapings. I don't know if that's the right word, but or peels. Peels are
right. Yeah, chemical peels, scrapings. That's like dermabrasion, which is another thing.
Sandpaper.
Like esthetician, where you want to improve texture of your skin. You want to feel that your skin's smoother, more youthful.
Now, is that something like if I had real bad acne as a kid and I've got a scarred, pocked type of a face, that's something that...
Correct. Yeah, so we would do microneedling, chemical peels.
Okay.
There's certain procedures to help improve scarring. Platelet-rich plasma. There's another one called platelet-rich fibrin matrix, or PRFM, that can be used to kind of stimulate kind of your skin's collagen. Also, we use it in hair loss. So I do specialize in hair loss, and so I'm very up to date in those elements, providing treatments that I think previously in this area there wasn't all that much access to from a dermatologist, but I think that's what we're hoping to bring to the area. In reality, hair loss is a dermatologist field, unless you're getting surgical hair loss. If you're getting hair transplantation, that's its own surgical subspecialty that does have some dermatologists within it, some plastic surgeons and some other folks as well. But the medical treatment of hair loss, like if you come early and often, we can, the vast majority of times, bring your hair back, stabilize it, and then a lot of the times it's not just regular hair loss, like, regular hair loss, like, oh, I'm inheriting it. We call it androgenetic alopecia, or just like hormone or genetic-induced hair loss. And in reality, a lot of the times people come in thinking that, oh, it's just regular hair loss, and we find that there's something else going on, and that we're able to correct it, stabilize it, and then keep their hair.
That's interesting. And then obviously surgical, I mean, you mentioned a mole or something that you want to get off, something that's benign. I mean, obviously you take a growth and test it to see whether it's, benign or cancerous. And
Correct. So, yeah, I mean, have a lot of surgical experience, whether it's removing a skin cancer, a benign cyst, a lipoma, these different things, different growths on the body, unwanted growths, whether they, be symptomatic or not. Generally for insurance coverage, it should be symptomatic or concerning but we would determine that at the time of the visit. Yeah, these things, I mean, making sure that we minimize the scar, keep the procedures as small as possible, using the newer techniques to reduce scar, and, comfortable operating pretty much everywhere. So it's one of those things where getting skin surgery at a dermatologist's office is actually much more comfortable than going into like a surgery center or into the hospital for a surgery. So it's very comfortable, outpatient. It's just the recovery is very minimal. So if you have to have something removed with us, I wouldn't dread it very much at all. It's very easy.
Well, I know, and also in dermatology, I would think in particular that the earlier the better, and I think that's probably most medical things. But when you see a problem, check it out. When you've got an issue, let's address it. I know my daughter did when she was younger, passed out, did a big old face plant on some concrete, and her face was all, had a couple good scars, and it was we didn't mess around. It was like, okay, let's talk to a dermatologist immediately, and then working with a plastic surgeon actually to turn around and do, instead of having, a general practitioner would have probably put 6 stitches in and said, okay, go home. And this one's putting like 30 in just to, but the secret for her success was to get it done early. And I think that, when you see a spot, when you see a strange growth or something that doesn't go away or keeps getting bigger or something like that, it makes all the sense to talk to somebody and get the diagnosis there. Who's your customer? Who's your sweet spot? If you could handpick your customers or your patients and say, okay, I don't want you, Myrna, because you're a pain in the neck. But are they younger? Are they older?
I mean, I definitely I feel like I connect with all different age groups, walks of life, all different colors of skin. And I was most recently practicing in National Harbor in PG County, just outside of DC. And
sorry,
it's a lot of traffic to get down there, but because I live locally. It was a really great opportunity to work closely with a very diverse community and to really make a difference and grow my own skills. And, I also trained in inner city Philadelphia and Camden, New Jersey as well. So I have a diverse experience of seeing a lot of skin of color and the issues and diagnoses that occur there, because it can be a little bit different. And I feel like right now in Annapolis, there's not a lot of skin of color experts as well. So, but my ideal patient, honestly, is anyone who needs a dermatologist because their skin is not doing the things that they want it to do. And it's, they have a skin condition in which they feel like it's never gone away or has been undertreated. Because I like to get people on whatever therapy gets them the goal that they need to get. And so sometimes we have to be a little bit more aggressive and do a little bit more treatment that I think some other practices in the area are reluctant to do, and to spend that extra time and to get you on more advanced treatments and therapies that, I want to make sure that we're treating, simple things like acne in the community correctly. So I definitely want to see a lot of teenagers and a lot of young people, because, just walking down the street and, walking in the mall, Annapolis Mall, downtown Annapolis, just walking down the street, I can see that there are still people in our community suffering from very treatable and very basic dermatology conditions that are pretty much controllable or curable very, very quickly with the correct treatment.
Well, you had mentioned you'd worked with, people of color, and I know I've seen studies and read, that African Americans tend to have a higher incidence of, we'll say, just cancers in general. And, there's, access to medical care and medical stuff. Do you find, is there anything with people of color that is greater or people that are more at risk as being a person of color than a Caucasian?
Right. So, the number one diagnosis in patients of color is generally hyperpigmentation. Their skin tone is uneven, and sometimes that can be caused by another dermatologic condition, but having uneven skin tones is very distressing. And I would say most commonly it can be caused by acne. It could be caused by eczema, all different types of other rashes. Also, a different kind of scalp rash called seborrheic dermatitis is fairly common. So I treat a lot of that, a lot of advanced treatment for that. But also alopecia is very common, especially when a lot of black women suffer from alopecia. And sometimes these alopecias are they're medical conditions. And the awareness is something that, is increasing. And I think a lot of patients are getting treatment earlier for these conditions, and making sure that they're able to keep their hair and, restore, kind of their hair growth and their, whether they be, on the edges of their hair, what we call traction alopecia from tighter styles, or just, genetically inherited types of hair loss, or inflammatory or types of hair loss where there's inflammation in the scalp that's a medical condition. And if it goes untreated, it can cause more extensive and or permanent hair loss. So really getting awareness out there to get those patients appropriately treated. Yeah, that's something I'm very passionate about as well.
Well, despite the slap of Chris Rock at the Oscars, certainly Jada Pinkett Smith has, brought a lot of awareness to alopecia through that whole thing, which I
correct,
think is
and that's exactly what I'm talking about. Conditions just like that, where early access to a dermatologist can make a big difference, and there are newer therapies out to treat conditions where there's total scalp loss of hair, and a condition called alopecia areata, and in other conditions where it's essentially an autoimmune disease or an inflammatory disease.
Mm-hmm. Okay, what do you do? Makes such a difference in people's lives. I go to the doctor and he says, turn your head and cough, and it's not life-changing for me. But you look at, certain practices, dermatology being one of them. I would imagine plastic surgery is another, and the weight loss, the gastric stuff and stuff like that. But you're taking a teenager that has zero self-confidence because of acne or what whiteheads, blackheads, whatever it may be, and really changing their life. You're taking somebody that is losing their hair, which I had a brother-in-law. I've got gray hair, but it's it exists. My former brother-in-law, lost it fairly early and always wore a baseball cap, and but you're taking these things and really changing lives and changing people. Does that make you feel?
That's the best part about it all, and that's why I'm in it. And those are the relationships that we build and we make in the clinic. And when people come in and you show them their photos when they first checked in and their first day, and then 6 months later, you're showing them what they look like now, and their skin is clear and they're smiling. And some of them are crying. Some of them are hugging me. Some of them are taking selfies with me.
Yeah,
they're putting it on TikTok, and they're I'm like, okay, it's exciting moments to really make that much of a difference and watch their self-esteem, their self-confidence, and just their general overall well-being just elevate to a whole new level. So honestly, you asked me what kind of patient I want. Those are the kind of patients I actually really want, because those are the ones I can make the biggest difference in. Those are your patients where their skin is really affecting their life or their quality of life, some sort of skin disease, whether it be moderate to severe acne, psoriasis, eczema, itchiness, sun sensitivity, something that, is causing either distress or, I don't want to say disfigurement, but, to the point where you feel like you're having to cover up the inadequacies of your own skin. I find that a lot of times where, you see a dermatologist and they say, oh, you have this problem, here's that cream. You have this problem, there's that cream. And sometimes that is the best treatment for mild conditions. But I find that historically, what I've seen in the community, in having practiced in the last 5 years in the area, is that a lot of these conditions are undertreated. And if we get them on appropriate treatments, they can reach new levels of clearance and control, and or feel like they don't have it anymore.
That's cool. Does stress play a big part in issues, skin issues?
So stress leads into almost every condition that we treat. It definitely compounds on just about anything, whether it be itching or rash or acne. It's all stress related, and there are certain stress chemicals, hormones in the body that are going to portend a worse prognosis for many conditions, especially acne, especially anything itchy, especially if you're undergoing a lot of anxiety or you're in a tough time in your life, depression, things like that. It compounds on the skin problem. I mean, and a lot of those things, if your skin is bad enough, it can make your anxiety, depression worse.
That makes sense. I mean, I always kind of thought that. I mean, it was, you get nervous about that first date in high school, and sure enough, that glowing zit shows up on the side of your nose or something like that. But I mean, I imagine that, as you go through life, and I mean, whether it be work pressure and home pressure and money pressure and everything else, that it's an easy out. I mean, the skin is the largest organ in the body, or
That's
outside
correct.
of the body, I guess they say.
Yeah, no, it definitely is.
What is the best thing anybody can do to make sure they have healthy skin? What do you impart on a 12-year-old to make sure that they've got the best shot at having the most healthy skin as they go through life?
Well, it's really having more like healthy skin habits and being really aware of, how important sun protection is. And I know it sounds like I'm beating a dead horse when we talk about sun protection because, dermatologists, the next word out of their mouth is sunscreen. But, all the research that we've found and everything that we know is that 90% of the skin's aging is from sun exposure. If you have healthy habits from a very young age, it will really improve the quality of your skin. You'll look younger for longer, and it will also reduce your overall risk in your lifetime of skin cancer, even though it, with the numbers I put out earlier, can seem somewhat inevitable. And then also for darker skin types and skin tones to also increase awareness in those groups, because they also can have aging of the skin problems worsened by sun exposure. And, if you wear sunscreen starting at a young age, whether it be on a daily basis or just with increased exposure, we found that it improves the quality of the skin, and those people are happier with their skin for longer.
We've got to also think that, I mean, when I think of sunscreen, I think of I'm going out biking, I'm going out hiking, maybe I'm going to the beach. I don't think about it when I'm going to the Giant.
Right.
I don't think, and we are exposed to the sun. We're sitting here right now outside of Ceremony Conference at the festival at Riva, and we are exposed to the sun. I am not wearing sunscreen. I never would think about doing it. But compounded, I imagine that's probably an issue.
Right. If you think about it, let's say Monday through Friday, you commute to work. If you can see and it's bright outside and you don't have a light on, the light is coming as ultraviolet. Even though it's not direct, it's there. So it's there, it's present all the time. Whether it's direct or indirect, you're still getting exposed. And that is the amount of that is what ages our skin over time. So putting a sunscreen on every morning and a moisturizer, let's say you have a 10-minute commute. I'd be lucky to have a 10-minute commute. If you have a 10-minute commute, that's 10 minutes in the car, maybe 5 or 10 minutes walking in and out of buildings. That time adds up over many years. And that's also why a lot of folks, like if you look at the top of their hands or their neck area or their face, will sometimes age a little bit faster than the rest of the body. If you look like, the underside of your wrist or your forearm, you look and say, oh, it looks so, there's not that many freckles there. There's not that many moles there. There's not a lot of, red-brown discoloration or, the skin seems to be more normal there. And that's because that area has been covered or not exposed.
Sheltered to the...
And also double covered areas, like you think about, like the underwear, like covers you, it's double covered. That area, also the skin, stays younger for longer.
Right.
And so it's important to kind of improve the quality of our skin just by covering from the sun, but also just being aware that, if you were going to put sunscreen on every day, you would treat your face, your neck, and I tell most patients the top of their hands as well, because those are the things that people come in later on and they feel like, I feel like I'm getting old. And where do they look? They look in the mirror, they look at their hands, and they look at their neck, and that's, and those are areas that we actually do a lot of cosmetic treatment, because those are what people see.
The turkey neck and the
exactly
everything else. I'm getting my own there.
Yeah, it's sometimes. I mean, that's probably not from the sun, but some things like loss of collagen and just normal aging, gravity, has its way with all
Gravity's
of us.
a bitch, man.
Yeah. So yeah, some of that could be more genetic and gravity based, but yeah, I mean, it's health and wellness is it's a compound, a multifactorial thing where it's a little bit of everything, diet, exercise, wellness, sun exposure, and age is really just a number, and age is how you, it is kind of how you feel. I mean, I've talked to 50-year-olds who are and feel 80, and I talked to 80-year-olds who feel 50.
Yep.
And so.
Well, I guess you're not a fan of my sister's sunning routine. That was Johnson baby oil, slathered on. And
I don't know if she had the reflectors or not.
My mom had the reflectors. Make sure you get underneath the chin to make sure I'm flashing back to the Something About Mary with the Magda out there, that one character that was in there. But that's obviously a bad idea. I don't even know what baby oil could be used for.
Well, I think it was just for bronzing and just feeling like you're, it's like you're cooking evenly.
Yeah, it's like like in a frying pan.
Exactly. So
exactly.
I think skincare has come a long way where we know the bronzed look, and if that's achieved through tanning beds, then that's the worst thing you can do for your skin is tanning beds. So we're always increasing awareness of that.
They're illegal in Maryland, aren't they? Or it's super restricted or something? Super
restricted, especially for minors, and there's a consent form that tries to make sure that you understand the exposure risk, the risk of skin cancer, and it is shown to be an individual risk factor for skin cancer, especially in folks who go in the bed over 100 times. It becomes more dire at that point. So I tell patients it's like smoking for your skin, so just don't do it.
Yeah.
Now, if you did it a couple of times, I'd still be mad at you, but I would tell you to stop.
Stop it.
But like if you did it, like the classic time is, people go a few times before prom or something, and they when they're in college or younger, and it's when your skin is the most youthful and well, and it's like you want it to be that way for a very long time, so it would be better off not to do that. So what level of a tan is okay? Really none.
Yeah, you don't need a tan.
Yeah, so you should not be seeking out a tan. Now, a little bit of healthy sun exposure with sunscreen to get vitamin D is fine, but vitamin D we find is a lot of people's excuse to get sun. In reality, it's best just to supplement vitamin D. If you're trying to routinely get that through sun here, as you already know, the weather's very unpredictable. Winter and fall, we're not getting enough anyway. It's better to just get into a routine of supplementation because a lot of folks are deficient in vitamin D, and having vitamin D at appropriate levels is very important to health and wellness.
You mentioned microneedling. What is that?
Right. So actually, it's thank God it's micro because it's really not that painful, or it's maybe a slight discomfort, but it is a procedure that's FDA approved using a device called the skin pen, which we use mostly on the face, but also to treat scar tissue and things like that. But for treatment of fine line wrinkles, it can induce collagen formation. So for patients with healthy skin, the other use of microneedling is in a lot of our acne patients to have acne scarring, and it is the treatment of choice. It is the most cost-effective treatment. It's the best bang for your buck for acne scarring. And treatment of acne scars can be a very expensive problem. So I like to start patients on that. Once we know their acne is in remission or is completely clear, then we will appropriately offer them a treatment plan for their acne scarring. Unfortunately, treatment of scarring is not covered by insurance.
Okay.
So that's considered cosmetic. But the treatment of acne is medical. And I mean, my message to most patients for awareness is if you have an acne scar or you have pimples that leave scars, you need to see a dermatologist. And you should most likely be on oral treatment. So if someone gives you a cream, probably there's nothing to prevent you from getting another pimple tomorrow, which would leave a scar. And any acne that leaves a scar is not your friend. And you want to treat that very aggressively to make sure that we maintain the contour and youthfulness and the appearance of your skin. We don't want it to get acne scars. Now, if you have acne scars, we can do a heck of a lot to fix it with procedures like microneedling, chemical peels, getting patients fully plugged in with with more advanced therapies like resurfacing, laser treatments. But as I start saying the word laser, you already know that it's more expensive.
Right.
So we like to start with the things that get the most bang for our buck, that are the easiest, the least painful, the cheapest. And so the goal is to get you to that treatment goal, and everyone's goals are different, but making sure that we make a plan that gets you to the goal and also stays within a budget.
Is Botox still a big thing?
Oh, yes. And so Botox was kind of the gateway drug for all of cosmetics and dermatology, and it still is. And there are many different types of what people call Botox now. There's competitors. So there's Botox, Dysport, Jeuveau. There's a new one called Daxxify, which is brand new on the market. But these are what we call neurotoxins that treat wrinkles. And a lot of patients will get treated every 3 or 4 months, or some patients every 4 to 6 months for a treatment. And so when patients come in for Botox, they think that, what's actually happening? The needles are very small. It's very, very tolerable, close to painless, and the effects are temporary. Now, if you get it done consistently, it can reduce signs of aging permanently because you're preventing wrinkles from forming and staying formed at rest. But being consistent with Botox, starting off small, starting off with low numbers of units so that you don't break the bank right out of the gate. The approach that I have is to be very subtle with cosmetics and to make sure that you're getting the best bang for your buck and you're not just being put through the same treatment plan for everyone. It's a little bit more personalized when you see a board-certified dermatologist who focus in this areas and, that you're not getting more than you need. The non-invasive techniques in cosmetics are becoming more and more popular because those are generally cheaper, they have less downtime, and they can be very effective and more subtle. Now, if you go, quote-unquote, under the knife,
yeah,
it tends to be more drastic. And some people like drastic, and that's fine. So like I said, it's not a one-size-fits-all, but the majority of people who want to dabble in either Botox or very well-directed kind of subtle treatments with filler injections, those things can be done very tastefully and very responsibly and very safely in the right hands.
How do you feel about tattoos?
So tattoos obviously are very popular. They're everywhere. They're increasing. Body art in its way is, it's a form of expression. And, tattoo removal is something that I won't be doing on day one. We might do that in the future. But in terms of skin health, is something where it can sometimes cover up a mole or a bad mole or disguise, issues, skin issues, and there are risks for scarring and very rarely reactions to tattoo pigment or also very rarely infections with the placement of the tattoo. So I frequently do treat tattoo rashes or tattoo infections when those do occur, and making sure that, patients, if they do get a reaction or an infection after a tattoo, that we treat them aggressively. And then with tattoo removal, you are best suited to go to a dermatologist practice that runs a tattoo removal laser clinic. And those devices are very specialized. The thing is, the reason to see a dermatologist is that if something doesn't go as planned, they know how to fix it. And if you go to a tattoo removal place that's in a, it's in a van or in the corner, it's set up in the corner of town somewhere, and the person's not a, trained medical practitioner or MD, then, you are running the risk that they only have one device, they use it, and if it works, great. If it doesn't work, then what next? They may not have the answer. And so best to start where, we know we can treat you to the end.
And I assume that, like any medical doctor, you accept insurances and all the popular insurances?
Yes, correct. So we're in network with all the major commercial insurance providers.
Is that a real headache?
Oh, you wouldn't believe. It's it takes time to contract and credential, and it can take up to 180 days. So it's actually the longest part of opening a practice is becoming fully credentialed. So I'm trying to make sure that we have really great access, because you can have a great new office, but if people can't access it with their insurance, it's not great. So I'm making sure to contract with all different payers, from commercial payers to Medicare, and also state-run programs and Medicaid and managed care organizations, So make sure that people...
So you do have the Medicaid and the Medicare as well?
Correct. So, not a lot of practices will accept Medicaid that are private. Some of the corporate offices will. But Medicaid access to care is a real issue. And a lot of plans, you may be pigeonholed into different offices where you may be seeing mid-level practitioners, but this is an opportunity to see a board-certified dermatologist with Medicaid, and I have availability right out of the gate. And I am really excited about that. And, when I went to medical school, I was trained to really make sure that we give back and open the doors, not just for some people, but for everybody.
Well, it does sort of seal the deal that you're looking to treat everybody in the community. I mean, from those that may have the means to pay for it without insurance or with insurance, as well as those that are on Medicaid or the seniors on Medicare.
And the last thing I want is in my community that there be people with very serious or undertreated skin problems that can't get access to a dermatologist that can fix them. So it's really important to have that access. And for me, it's about the difference that I can make, and it's not about how much their insurance plan would pay.
Well, Dr. Neidig, when is your office opening? I guess that's the million-dollar question there, isn't it?
Yes. So we're opening for a soft opening the first week of June. So some of our patients that we already have relationships with will be coming in then. We'll be having a grand opening shortly thereafter, either later in the month of June or early July. So we'll have an exact date on that. But, stay tuned. That'll be available online on the website.
Well, the website is moderndermatologymd.com, right?
That's correct. Yep.
Makes it easy to remember.
Right. Try to make it simple, no acronyms or anything like that to make it difficult.
Well, anybody has any questions about their skin, I think keep an eye out for the grand opening. Come on in and say hello. They are at 2568 Riva Road, and that's Suite 102.
Correct.
Again, moderndermatologymd.com would be the website, and it's Dr. Lane Neidig, who's coming to town. I say a local boy coming to town, but born, raised here, went to Philly. Can't fault him for that to get some.
Right. And, I love Philly. But I, really came back here to make the impact and be close to family, friends. And I see faces all around town that, people I grew up with. And so it's, if you're looking for a dermatologist who's not going anywhere, I have 30 years left to practice, and I'm not going anywhere. So a lot of patients say, are you going anywhere? Everyone I get leaves, or everyone I get, disappears. I'm not going anywhere, and you can build a relationship with me like you could your neighbor. And I'm very personal and very open, and I'm trying to make a relationship with all my patients so that you know me and I know you.
Your wife is also a practicing pediatrician in town as well, so...
Right, so you could say the other Dr. Neidig, or just Dr. Neidig. We're both Dr. Neidig. And so she's a practicing board-certified pediatrician in Edgewater, Annapolis, as part of Annapolis Pediatrics, one of the most well-established practices for kids here in Anne Arundel County.
I'll vouch for 30 years of that for my own kids. So.
Yeah, so they're great. So I'm hoping to see a lot of the kids from their practice and hopefully make an impact, with having a dermatologist that's focused on kids and enjoys seeing kids, not just the minority of the patients, but making sure that they're getting access to treatments for acne in the correct time frame, having, advanced treatments for things like, atopic dermatitis, eczema, anything that's, upsetting the balance of the skin at a young age, getting them on that journey at a young age so that they can maintain their skin health and start early. And the earlier we start and we get either, have them on good habits or on healthy control of their skin problem, the sooner they'll feel more comfortable in their own skin.
Fantastic. ModernDermatologyMD.com. You want to look for a grand opening in June. And Dr. Lane Neidig, thank you so much for your time today.
Thanks for having me.
Thanks for listening to this week's Local Business Spotlight. Please make sure to visit eyeonannapolis.net for all your local news, events, and opinion. And in case you haven't already, please subscribe to the Eye on Annapolis Daily News Brief, where we bring you all the day's local news direct to your phone, tablet, or computer in about 10 minutes. It comes to you at 6 a.m. every Monday through Friday, and you can subscribe on Apple Podcasts, Google Podcasts, or wherever you get your podcasts.